Frequently, when reminded of America's dark past of medical experimentation or healthcare towards African Americans, people tend to think of J. Myron Sims and his experimentations on Black women, or most likely, the Tuskegee experiment. What most Americans do not know is that a lot of the racial attitudes towards African Americans in the Tuskegee experiment can first be seen in the United States Public Health Service's venereal disease clinic located in Hot Springs. This documentary will argue that racial attitudes towards African Americans who fell ill with syphilis in Arkansas give insight into why the Tuskegee experiment occurred due to scientific racism and eugenics. What is the USPHS Venereal Disease Clinic and why was it established? The Venereal Disease Clinic in Hot Springs was a federally funded clinic founded in 1921 after World War I. Many Arkansasians would attempt to report for duty or enlist, unknowingly being sick and infested with syphilis, especially in Arkansas with Camp Pike in Little Rock. Due to the influx of possible soldiers being turned away, it created an eye-opening problem for the United States to treat people with syphilis. Being infected with a venereal disease made soldiers unable to fight in the war, causing a severe issue for recruitment in the war's workforce. Camp Pike's infestation was attributed to its proximity to Hot Springs, where prostitution had been legal since the 19th century. The American view of syphilis had been one of a sinful nature. The moral point of view towards those who had syphilis had not been a kind one, especially African Americans who had been infected with syphilis. African Americans who had been viewed as sexually immoral people, and the problem of solving it relied on the white population. The ideology of African Americans being sexually immoral dates from the first encounters of Africans with Europeans in Africa. African people traditionally wore little clothing. This to Europeans spoke to the sexual appetites of African peoples. This perspective would then follow African Americans and would continue during slavery and afterward. Historically, African American men during slavery had been seen as overly sexual and unable to control their sexual appetite. To physicians, African Americans held excessive sexual appetites and were unable to control urges, which then threatens white society and increased the chances of African Americans contracting venereal diseases. African American health problems during the 19th century had been considered one of the white man's burdens. In general, the health of African Americans was seen as not alone a question of concern to the Black man, but as one of the equal moments to the white population in communities where Negroes are found in any considerable numbers. Considering these ideologies, government bathhouses in Arkansas were allowed both white and Black people to be treated and experimented in the hope of finding a cure or suitable treatment for syphilis. Who was the director of the USPH VD clinic? Dr. Oliver Clarence Wagner was a doctor specializing in venereology. Dr. Wagner received his medical degree at St. Louis University in 1908. He served during World War I in the Medical Corps of the Missouri National Guard. He later then traveled to France and England as a part of the Venereal Disease Control Unit and a sanitary squad. Eventually, Wagner fell in love with venereology and continued specializing in it. Wagner continued his fight against venereal diseases in Hot Springs from 1921 to 1936 as the director of the VD Clinic in Hot Springs, in which he applied racial ideas and sciences towards African Americans and their treatment and or knowledge about their conditions. Wagner would later proceed to join the team overlooking the Tuskegee experiment in Macon, Alabama, where he would ignore the rejection of providing adequate treatment to African Americans suffering from venereal diseases. Though Wagner had treated African Americans using mercury in Hot Springs, Wagner thought a study considering the difference of effect on whites and Blacks infected with syphilis would be a study worth doing. Wagner had considered his time at the clinic to help conserve the white race from debilitating diseases. This was shown in his overall treatment of white patients. White people were given special privileges by the VD clinic director. Meanwhile, the health of African Americans meant little to him. When referring to African Americans, he is quoted stating, "We must remember that we are dealing with a group of people who are illiterate, have no conception of time, and whose personal history is always indefinite." Despite Wagner's racial attitudes towards African Americans, he created new efficient systems administering medications to patients in Hot Springs. Preparatory to receiving treatment, the patient straddled a bench, rolled up a sleeve, and placed an arm on a table. A nurse applied a tourniquet and washed the arm with alcohol. An assistant inserted the needle and adjusted the indicator on the gravity tube. A second nurse removed the needles and sterilized them. Wagner's new method enabled a staff of 4 to administer 98 doses of medicine in 48 minutes. Under the old method, 12 members could handle only 20 patients per hour. What was the treatment like for African Americans in Hot Springs? Though African Americans had been allowed to receive treatment in the VD clinic under Dr. Wagner, it had been inadequate and unequal compared to white patients. African American patients who came to Hot Springs in the hopes of receiving care typically came with more advanced stages of syphilis than their white counterparts who were also infected with syphilis. Not only were African Americans arriving to get their treatment later, but they also came with less funding. With less funding for housing, while receiving treatment in more advanced stages of syphilis, African Americans would not receive the medical attention they needed. Treatment given to them under the direction of Dr. Wagner would be a fourth less than what white patients received. African Americans, on average, were given 9 treatments of arsenic. Meanwhile, the white patients received 12. While receiving their lessened treatment at the VD clinic, African Americans experienced some hostility from their medical professionals. One local physician named Dr. Abington had an incident with a black patient named George Smith. Smith was receiving mercury treatment for syphilis at the clinic when he suddenly became upset, and in reaction, his doctor became angry and threatened to ruin Smith. Responding to the incident, Wagner advised Smith to stay away from the clinic, and Dr. Abner was never punished for his outburst. And his sudden loss of temper had been chalked up to his prejudice towards African Americans. Outside the clinic, Dr. Wagner advocated for white patients to help them complete medical treatment despite their social status or wealth. However, Wagner never showed that regard towards African Americans. Instead, Wagner would help his white patients obtain housing, food, and work to continue their treatment at the VD clinic. Wagner and his staff would additionally be seen on record supporting their white patients financially and helping them attain housing. Yet that support had never been given to their African American counterparts. Wagner had advocated for white patients to the federal government to help attain housing, funding, and transit for his patients after seeing most patients being unable to afford their stay in Hot Springs and continue treatment. This resulted in the Federal Transient Bureau giving all patients housing and transit. Still, Camp Garraday was built for unmarried white men the following year. Yes, African American people had some support through the FTB, however, it still lacked in comparison to the support of white men. Wagner never fought the Jim Crow laws affecting African Americans that disenfranchised them to receive proper and complete medical treatment for their illness. Those African Americans who did not receive support from the FTB had difficulty finding housing. Due to Hot Springs being desegregated, African Americans struggled to find hotels that would allow them refuge. In and outside the clinic, those African Americans seeking treatment in Hot Springs were seen as inferior and undeserving of the same treatment as their white counterparts. What is the Tuskegee experiment? The lack of Dr. Wagner's perspective on the value of African Americans' lives did not stop in Hot Springs. Instead, it carried on to Macon, Alabama, and the 1932 Tuskegee experiment, which he had now been appointed to oversee as an investigator of the USPHS venereal disease clinic. The experiment was conducted in the hopes to observe what happens to the body if syphilis is left untreated. The experiment would consist of 399 men who were already affected with syphilis and 201 unaffected men as a control group. In Tuskegee, they would subject impoverished and primarily illiterate African American men in Macon as physicians within the USPHS thought Macon suited best due to its high syphilis rates. Dr. Clark thought that as long as syphilis was so prevalent in Macon and most blacks went untreated throughout life, it seemed only natural to Clark that it would be valuable to observe the consequences. According to popular thought during the time, the treatment of African American syphilitics would be impossible due to how late they would seek treatment. Throughout the experiment or a study in nature, doctors would inform these men, Throughout the experiment or study in nature, doctors would inform these men that they had bad blood and would receive free treatment if they returned to the Tuskegee institution for treatment. Unfortunately, these men were never notified that they had a sexually transmitted disease that infected their blood or how to treat it properly. Doctors administered aspirin, vitamin tonic, and spinal taps as treatment, despite the discovery of syphilis being cured by penicillin in 1943. The aspirin and vitamin tonic served as placebo, while the spinal taps were to test for evidence of neurosyphilis. Additionally, subjects would have to agree to an autopsy after death to receive the funeral funding benefits provided by the experiment. USPHS physicians feared that if the subjects were notified of the possibility of death during the experiment, they would stop their participation. Dr. Wagner, on this subject, wrote to the director of the Tuskegee experiment in 1943, Dr. Vonderler, "There is one danger in the latter plan, and that is if the colored population became aware that accepting free hospital care post-mortem, every darky would leave Macon County. Subjects, according to Tuskegee doctors, would not be valuable if treated. As I see it, we have no further interest in the patients until they die. The lack of treatment lies in the belief of most Americans and most American physicians that African Americans were inferior, and it was not inhumane to not treat their patients." The experiment continued until 1972 when a whistleblower uncovered the unfortunate events. Around 128 men in the study died directly from syphilis or complications of the illness. Subjects of the experiment would not get any apology for the ill use of their bodies until 1997, when President Bill Clinton issued an official apology where he acknowledged that the experiment had been based on scientific racism. How did the Tuskegee experiment connect with hot springs and the treatment of African Americans? In recent years, historians have looked into the past and seen the negative evolution of medicine. They have seen that race plays a role in the medical treatment in subjects for experiments. Frequently, it is mentioned that Tuskegee was an unfortunate event where subjects were all chosen based on race and racist stereotypes held at the time. Historians have constantly pointed to the events at Tuskegee to assert why African Americans have mistrust towards modern medicine now. However, what is often forgotten is scientific racism has impacted America outside of Tuskegee, and other medical events have caused mistrust in the Black community. In Hot Springs, African Americans experience an unequal experience in treatment and in care while being taken care of by a federally funded clinic, due to the fact that physicians there held on to scientific racist ideals of African Americans being unable to control their desires and that they were inferior to their white counterparts. The superiority of white patients inside the clinic relied on the idea of race conservation. Meanwhile, in Macon, Alabama, subjects were directly chosen for race due to the racial stereotypes held by physicians. These physicians would then withhold treatment due to the racist idea that African Americans would not seek treatment regardless due to the lack of intelligence. Doctors participating in the experiment felt more comfortable withholding treatment from their subjects all due to their race. Similarly, how two doctors in Hot Springs did not fight for African American patients because they were inferior in their eyes. What happened in Hot Springs, Arkansas at the USPHS clinic helps us to understand the ideology employed against Macon farmers at Tuskegee.